Hi, I am Dr. Vinayak Munirathnam. I am a senior consultant in medical oncology and haemato-oncology at Fortis Bangalore. I will be speaking about lung cancer in never smokers. Now, we all know that lung cancer is one of the leading causes of mortality among cancers, about 1.8 million deaths globally over a year. So it is a large global issue, and we also know that tobacco is the predominant causative agent in most of the cases of lung cancer. However, despite its preponderance or predominance as a presumed etiological agent in lung cancers, there is a special entity in never smokers. Those are people who have not smoked at all in their lifetime, or the ones who have smoked hardly less than 100 cigarettes in their lifetime. So in this particular entity, we have been seeing that there have been increasing number of cases of lung cancer. Now, from a biological and an epidemiological standpoint, this forms a very different entity. So, what causes the lung cancer in these particular patients? That is what I want to discuss about. Now, among the causative factors, one important cause is second-hand smoke. Now, second-hand smoke can again be attributed to tobacco, but these are non-smokers, and the problem remains with the immediate kith and kin, where the exposure to second-hand smoke is on a constant basis and on a longer duration of time. So, they are at an increased risk. And the other risk factors being, one is occupational exposure. For example, radon. Now, radon is a byproduct of uranium and radium, especially seen in miners. So, there that mining industry, where the miners are at an increased risk for lung cancers. And the other one being environmental exposure. Environmental exposures like asbestos, chromium, and then arsenic. Arsenic especially is a contaminant in water and seen in well waters in some of the parts of the country. So that again is a risk factor. And the other risk factor is dietary agents. Red meat, as you all know, is a risk factor in GI malignancies and colon cancer, but also in lung cancers, it is having an attributable risk. And indoor pollution, again, indoor pollution in our Indian setup is very important because the way of cooking, we use more of deep fried items, deep fried foods, where the smoke from heated oil again puts the person at a certain amount of risk. Apart from that, outdoor pollution. Outdoor pollution is a significant factor in metro cities where people are exposed to long-standing traffic, too much of exposure to smoke, unhealthy air, polluted air. All these put the people at a increased risk for lung cancers. And the last one being underlying lung conditions. If a patient has some inflammatory disorders or underlying interstitial diseases of the lung, they are at an increased risk of having lung cancer. So these group of people, though they do not have direct exposure or habit of smoking, are still at an increased risk. So in summary, although we say that tobacco is a significant causative agent in lung cancer, this entity of lung cancers in never smoker is an increasing problem. And knowing about these risk factors and trying to reduce the risk and preventing them would help us reducing the incidence of lung cancer in this particular entity. Thank you very much.